Now, what is Kirkcaldy-Willis cascade or the stages of disc degeneration? So there are different stages of disc degeneration. The first is the dysfunction. Now, dysfunction is basically something that is age-related. All the discs get dehydrated, they get degenerated, and they start to desiccate. Once this starts to happen, there is also simultaneously some regenerative, I would say, or some anabolic effect also in place. That is a synthesis in place. With respect to this, it tries to uh, seal off the defects, I would say, or try to repair the defects, or try to repair whatever catabolism or whatever damage has been done. However, one thing we have to understand, that the ratio of the catabolism and the repair may not always be the same. Whenever the repair is faster, you are not going to get significant changes. But whenever the repair becomes slower and the catabolism or the dysfunction or the damage becomes higher, that is when you start to develop even further changes. So the second stage which is there, that is the instability. So what is this instability? As you are seeing in the second image over here, when the degeneration proceeds significantly, these particular facetal joints over here, this is where one vertebrae gets locked with the other. So this also comes in impact, which causes some amount of abnormal movement which shouldn't have been there, or even with the normal movement it is putting a lot of strain. And once this happens, the third phase goes in the restabilization, where you are seeing the disc height is significantly reduced. The facetal joints have also undergone arthropathy or the degenerative changes, wherein they have got facetal dysfunction is also there somewhat, I believe, over here. So these are different changes that have undergone just because the catabolism is way higher as compared to the synthesis or the repair or the anabolism. So whenever this imbalance happens, that is when the Kirkcaldy-Willis cascade tries to tell you that why exactly the degeneration is happening and how exactly does it progress. Now, the limitation with Kirkcaldy-Willis cascade was patients with changes meeting the diagnostic criteria were symptom free, and even they believe that some patients may miss on some of the middle path and they may directly go from dysfunction to restabilization. So these were the limitations that people were caught up with respect to exactly establishing the Kirkcaldy-Willis cascade, and why exactly it cannot explain the degeneration that would happen in all the patients. Now, what are the etiologies or the established risk factors for having a slip disc? Obesity or lifting heavy weight are established risk factors. Along with that, lifting heavy weight in a bad posture is also a risk factor. Smoking, alcohol, and even tobacco use are risk factors. Any form of injury is also a risk factor. Bad postures while driving a two-wheeler or a motorcycle is also a risk factor. Sitting is the new smoking. That is when the people are having a sitting job and they don't maintain the posture. So that also adds to it. So whenever we have these particular risk factors, that is something that takes us to the slip disc, or the chances of degeneration in these cases increases. So trauma or injuries, smoking, alcohol, tobacco, bad postures, prolonged sitting, not following the work ergonomics, poor posture while lifting heavy weight, obesity. So these are the risk factors wherein we believe that the slip disc may happen.